Good morning. My name is Michelle Lavander, and I'm the director of the USC Center for Health Journalism. Thanks for joining us for our webinar today, covering coronavirus, how two top reporters navigate COVID confusion. As we enter the third year of the pandemic, Omicron's precipitous rise continues to set off alarm bells. Yet experts seem to increasingly disagree about key questions of public health, infection control, and even where we stand as a nation in the fight against this highly infectious variant. It takes nuanced reporting to cover the latest, often confusing developments. As scientists race to understand this latest variant, prominent researchers are challenging highly regarded federal scientists on such fundamental issues as isolation and quarantine recommendations, testing, boosters, and whether COVID has become endemic. In this webinar, we're privileged to hear from award-winning journalists Helen Branswell of Stat and Katherine Wu of The Atlantic as they discuss their strategies for staying ahead of an ever-changing and exhausting story. Helen is a senior writer at Stat, covering infectious diseases and global health, and leading Stat's coverage of COVID-19. She joined Stat at its founding in 2015. Helen was introduced to epidemic reporting during the 2003 SARS outbreak. In the years since, she's written about bird flu, the H1N1 flu pandemic, Ebola, Zika, polio, and measles. She spent the summer of 2004 embedded at the Centers for Disease Control and Prevention as a CDC Knight Fellow and was a 2011 Neiman Global Health Fellow at Harvard. In 2018, she won the Association of Healthcare Journalists Award for beat reporting. She was the recipient of a 2020 George Polk Award for Public Service for her coverage of the COVID-19 pandemic and was awarded the 2021 Victor Cohen Prize for Excellence in Medical Science Reporting. We're also delighted to be hearing from Katherine or Katie Wu, a staff writer for The Atlantic, where she covers science. She's also a Story Collider senior producer and a senior editor at the Open Notebook. She previously served as science reporter for the New York Times, where she reported on the pandemic. She's also been a staff writer for Nova Next, an early career fellow at the Open Notebook, and an AAAS mass media fellow at Smithsonian Magazine. In 2018, she earned a PhD in microbiology and immunobiology from Harvard. She's the 2020 winner of the Everett Clark Seth Payne Award for Young Science Journalists and the 2021 Science and Society Journalism Award. A few words about our webinar today before we get started. We'll hear from our two speakers first, and then we'll have a chance for them to answer your questions. You can put your questions in the Zoom Q&A panel, as well as any technical concerns. We'll be recording this webinar, and you can find the archived version later today at centerforhealthjournalism.org. You could tweet about the webinar at the hashtag COVID. This webinar is made possible thanks to the generous support of the Commonwealth Fund and the National Institute for Healthcare Management Foundation. And now let's get underway with our two speakers. There's so much confusion about exactly where we are with COVID-19. This morning, the New York Times has a headline that says, Omicron is in retreat, that quotes New York Mayor Eric Adams saying, we are winning. But 24 hours ago, the Washington Post had a headline that read, Omicron hasn't peaked in US, Surgeon General says, warning that next few weeks will be tough. So have we hit the peak or not? Have we reached the point where we consider COVID endemic, or is it too soon? And what does that mean anyway? Katie, you wrote last week that the worst of Omicron may still be coming and warned readers not to be lulled by the word mild. How would each of you describe where we are right now in the pandemic?
Happy to start here. I think at this point in the pandemic, I can say we know a lot, but things are still quite bad. I would not necessarily say that this variant is yet in retreat or that we are out of the woods. I think if the past few years have taught us anything, everything hinges on behavior, how we react to news. I think if we decide that this is the end and being, past the peak, if that is even where we are, which is not necessarily the case, that could significantly change the trajectory of the next few weeks ahead. I tweeted the other day that I had a cycling coach once who told me, when you reach the top of a really long hill, there's this temptation to stop pedaling and sort of just enjoy the downslope and let go. But really the advice is to keep pedaling so that you can hit the end of the downslope as fast as possible and maintain your momentum. I think that's the sort of attitude we need to maintain now, whether we're right before the peak, at the very tippy top of the peak, on a longer plateau, or even coming down this downslope. I think if we are thinking about the end of this curve, it's going to take a long time to get there. And the fact that we have peaked so high means there is a really long way down.
Thank you, Katie. How about you, Helen?
I would agree. I mean, we have to keep in mind that just because we're at the peak doesn't mean the wave is over. There are going to be at least as many infections on the downward trajectory, and we don't know if it's going to come down quite as, precipitously, or if it's going to tail out. It could very well have a tail. So, there's still a lot of people who are going to contract this virus in the coming weeks. The signs that in some parts of the country, we're not all at the same place right now, but in some parts of the country, the Northeast, for instance, we may be sort of at the peak or a little bit past the peak, but that doesn't mean that this wave is over. It really is. There is really a ways to go before we can think about Omicron maybe being in our rearview mirror.
So as you reach these kind of assessments, you're really having to sift through a constant flood of information and studies, not to mention prominent thinkers squaring off against government health leaders on Twitter. How do you keep up with all this and decide what to focus on?
It's really tough. It's been the toughest thing in the pandemic. For me, I really, in this part of my career, I've been able to focus pretty exclusively on infectious diseases. And so I really like to know the subject I'm writing about very well. But with COVID, the story is so massive, and stuff is, there are inputs coming all the time. It is really hard to keep up on it. And frankly, I feel most days like I'm not. Somebody's constantly saying to me, "Oh, well, you saw the paper by," and it's like, no, where, which, bioarchive, medarchive, it is a very difficult thing to do. And I personally have had to sort of get used to the notion that other people at STAT are covering some parts of the story much closer than I am, and I have to figure out which lanes I can drive in and try to keep up on what's going on there.
Yeah, I totally agree with that. I'm doing something quite similar at the Atlantic. There are three of us, me, Ed Yong, and Sarah Zhang, who are working kind of full time to report on the pandemic. And we don't really have super set sub beats, but I think each of us have tried to just accept that, even covering a third of the pandemic is probably too much. We can't even fully occupy the lanes that we are trying to drive in. And the acceptance brings some peace of mind. It's really interesting. I also hear from my sources, "Oh, you must have seen that paper, you must have seen that preprint." Now I'm even starting to hear on a weekly basis, "Oh, you must have seen that tweet from Trevor Bedford." And I'm like, I can't read every single tweet all the time. But I'm always happy to say, "No, I didn't, but please drop me a link if you don't mind." Just being very open, and even sometimes frequently asking my sources, "Hey, I'm curious if you have seen something recently that has changed your opinion on something that we talked about as recently as last week." The information just changes that quickly. And I think having humility and open-mindedness and accepting that my mind might be changed even hour to hour makes this a little bit more palatable.
As you said, Katie, the picture is really changing sometimes hour by hour. And with that in mind, what trends and developments are you tracking right now?
Yeah, that's a good question. Gosh, I was just saying how I was trying to narrow my focus, but what am I not tracking right now? I think there is a lot of conversation around the peak and what lies after it. I'm really curious about that and how we sort of navigate what I think a lot of people are seeing as the off-ramp to the pandemic. Is the picture more complicated than that? Where is our immunity going to take us? I think, like Helen, I've been thinking a lot about vaccines the past couple years and just immunity in general. How are people conceptualizing it? I'm also just constantly thinking about ways to sort of communicate what's going on and where sort of errors in communication are lying. Something that I think has obsessed me for the past 2 years is this tendency to sort of break very complex spectra of phenomena into very discrete buckets, and why that often gets us into trouble. What is mild versus not mild? What does it mean to be immune versus not immune? Like, what is between those extremes, and how can we better communicate that to inject a little more nuance and also just appreciate what the passage of time does to our understanding of those things? That is a very brief sampling of the things that are on my mind, but I think at this point, I'm both very tired, but still open to becoming curious about new things. I think that has to be the case when the story changes this fast.
And Helen, did you want to weigh in on that? For example, I thought it was interesting that you decided to hone in recently on this idea of US plans to collaborate with scientists globally on updating the COVID vaccine. Very few outlets gave it that level of attention. Why did you decide to follow that story? And what else are you keeping top of mind at this moment?
Well, I mean, one of the key questions right now is what happens with the vaccine. Should it be updated with Omicron? If Omicron blows through and something else replaces it, is being vaccinated with Omicron going to give people the level of cross protection that the original Wuhan strain vaccine has done? I mean, it's, a number of the people I've spoken to very recently have marveled at the fact that the vaccine is still doing a pretty good job at protecting against severe disease and hospitalization and preventing deaths, given the genetic distance between what is currently circulating and what was in the vaccine. So, these decisions have to be made. They have to be made sort of on a global basis. And it had been, to my way of thinking, not 100% clear whether the US was going to take part in this decision-making process that the WHO and the European Medicines Agency and other international agencies have been keen to put together, something that sort of tracks with the way flu vaccine is updated, where decisions are made based on a preponderance of scientific evidence, and then manufacturers are told this is what we'd like the vaccines to include, and then they go off and make it. I think what I heard when I wrote that story was that the US is not interested in vaccine manufacturers individually going out and making decisions based on their own profit margins or their own initiative. They want a more coordinated approach, which I think, from a global point of view is probably a very good thing.
Thank you, Helen. And switching gears a little bit, as you're both writing these really nuanced stories, there's a whole parallel universe of news, everything from Fox News to Dan Bongino's right-wing media footprint and others who are influencing how millions of Americans think about the pandemic. Do you track this? Do you feel your coverage needs to respond to or acknowledge this, drumbeat of conspiracy theories and scientific misinformation?
I could start if you don't mind, Katie. It's, it is a fact of life, and it's unfortunate. I don't spend a lot of time poking through that world, diving down rabbit holes. I have so much on my plate. You really have to make decisions about what is the best way to use your time. And I'm not suggesting that helping poke holes through things that should have holes poked through them isn't an important use of time, but you just have to think very carefully about what stories aren't going to get written. If you write yet another story about why hydroxychloroquine isn't really the answer to the, pandemic, if there were more of us, I think we would spend more time on it, but it is, that's a very time consuming part of the story. And And I really only dive in when I think there's something that really, where I could be useful, I guess I would say.
Yeah, I feel pretty similarly, and I think that's been my approach as well. I actually can't remember the last story I did that was kind of a direct debunk of something. I'm also not diligently tracking those things. I think it is also just a time and mental health consideration at this point. But, I of course do want to acknowledge how important that is. And certainly if something were to rise to the level where it was being, tweeted tens of thousands of times over by extremely prominent people on Twitter, I think that would rise to the level where it would at least be discussed amongst myself and my colleagues and our editors, and giving a sense of do we give this airtime? I think debunking misinformation, this is also a big consideration for me. Writing those debunker articles can often feel like twice the effort because you have to be so cognizant of not accidentally amplifying the misinformation itself, structuring the story so carefully that the truth sandwiches the misinformation and that it's blown past, but also acknowledged and, sort of digging to the root of that. I think with so much actual factual information that I want to share at this point, I'm diverting my focus elsewhere. But I guess the other thing I would tack on briefly is if I'm ever invited to speak on a podcast or a radio show or even a news spot on TV and that sort of thing comes up, I think that can be an opportunity to very quickly address something, and maybe that will even help new information reach new audiences in ways that I couldn't with my writing at The Atlantic, which admittedly does sort of cater to a pretty specific, sometimes insular audience.
One feature of our public debate about COVID has been the way that some lawmakers and public officials are seizing on each scientific shift in direction in a kind of a gotcha tone, almost as if they've caught a politician breaking a promise, or almost if it's corrupt. And if there's a shift in messaging or recommendations and mandates, and that there's somebody is lying, and clearly there's been a lot of communication stumbles coming from this nation's leadership. But how do you communicate in your writing that science is iterative and it should change, especially in a moment like this one?
I'm happy to start this one off. This is one that I think about very often. It was really only 4 years ago that I was a practicing scientist, which also feels like 400,000 years ago. So I don't know what I'm talking about anymore. It is so difficult because, really incremental, iterative, sometimes ambiguous findings don't lend themselves to snappy headlines and 280 character tweets. It's really challenging. And I think especially in a time of crisis, people want answers that will not only be true today, but tomorrow, next week, next month, and will guide their behavior all the way out of this pandemic, all the way to the light at the end of the tunnel. We can't really offer that with so many things changing, even the virus itself changing. That has been really difficult. But, I don't think I have a perfect answer to this, but things that I'm always thinking about is just really being direct about it. I will sometimes write in my pieces, this is incremental. We do not know X, Y, or Z. Or I will quote someone who has a lot more authority than I to say, this person does not know X, Y, or Z. I really admire pieces that do this. I think actually Helen's today said this, experts were unwilling to confidently forecast exactly what's going to happen next. And that's the kind of transparency that I think we do need to have. Having humility, being really clear about what expertise is and is not. It's not having a perfect crystal ball. It's being able to comment authoritatively and also being able to authoritatively say where the limits of expertise are. And whenever I have the opportunity to sort of describe how science is done, whether it's like this was a model with A, B, and C limitations, or this was very specific to this population at this time and may not apply elsewhere, those limitations are so important to lay out. And I think it just shows that one, science has to be really well controlled to yield results that we can confidently speak about, but that also means this won't apply in every situation. And I think just being transparent with that and trusting that our readers can handle that level of nuance, that's really key in this.
Thank you. And Helen, did you want to add to that?
Yeah, I mean, I agree. I think, unfortunately, science education isn't as good as it ought to be. I don't think that a lot of people really spend a lot of time thinking about the fact that science is iterative. I think they like to think of it in terms of, something that's binary. It is or it isn't. This is good, this is bad, and that isn't the way it is. And so it is important. It can be hard to remember to put those. I mean, I'm all for caveats and I put lots in my stories, but it can be hard to remember to help readers understand that just because somebody said something previously and now they're saying something else doesn't mean that they've done an about face or they were lying earlier. I mean, in some cases that is true, but as journalists, we often sort of look for changes in policy or changes in somebody's position and juxtapose it against what was said earlier to try to see if we've caught somebody in a lie or if somebody is doing it about face. That works for political reporting, but it doesn't work as well in science reporting. And I think that's something that we need to keep in mind. Katie has a PhD. She came to science reporting from a background of science. I was an English literature major at university. I, was a general news reporter for a long time and then became a science reporter. And it's something I've sort of had to teach myself to be careful not to do that sort of knee-jerk thing. And I think that in the pandemic in particular, so many reporters were pressed into pandemic coverage. I mean, because this wasn't just a science story, it's a political story, it's an education story, it's it's a consumer story, it's everything, it's a business story for sure. So I think maybe people didn't necessarily understand this facet of science reporting, that sometimes things change and we should be grateful that they do. It's a signal that we've learned more.
Thank you, both of you, for these thoughtful insights. And another thing that reporters are grappling with right now, especially those who, as you point out, Helen, are suddenly covering this and maybe hadn't covered science before, is how to handle and how to properly vet things like preprints and breaking COVID news, and thinking through what questions they should ask and how they check things that are happening so quickly when there's such intense competition. And Katie, here I'm thinking of something that you mentioned the other day, which was that you had done almost a mini lightning style peer review before publishing on one finding. Can you walk us through that process?
Yeah, I think this is a really interesting time to be reporting on incremental findings because they have become so incremental and so fast. Like I think all the way back to the beginning of the pandemic when, most of us, I think still the standard was peer reviewed papers. And then it quickly became like, we're really reporting a lot on preprints, and not everyone is necessarily acknowledging that the studies they're linking to are not peer reviewed. And now we're seeing a lot of data just being shared straight on Twitter, no methods, no sample sizes, just kind of like a screenshot. And that's awesome. I do think it is fantastic to see information pouring out this quickly. And I do like to think that a lot of this is due to a collaborative spirit. People probably want to be first to share something, but also they want the world to see it and so they can act on it. So policymakers can make decisions, and people's findings can corroborate each other's, or so discussions can happen as quickly as possible. This is not something we would have been able to do, even 10, 15 years ago. That said, because there is not as thorough of a vetting process, certainly not on social media and not really on a lot of preprint servers, this becomes really tricky. I think the risk reward of reporting on a preprint just becomes this enormous range of, could I get this really, really wrong? And so knowing that a formal peer review process hasn't happened before a preprint was posted, if I know, like I very rarely report on single studies anymore, but if the occasion should arise, I think I would I guess I generally already over report, but I would go out of my way to contact many, many sources, say, hey, can we talk through this? Do the methods look sound? Don't just react to the abstract, but can we go through and just make sure that we are doing a sort of, as you said, a mini peer review to make sure that I'm not wasting my time on something that will mislead my readers, that is possibly too incremental for me to be reporting on. Really has to meet a bar, because this is ultimately not for the authors of the paper or anyone else, or for me, or making sure that I don't waste an extra hour on a preprint that I won't ultimately cover. It's for my readers and making sure I'm not wasting their time and I'm not abusing their trust in this process. It is really tough. And honestly, where I land most times is I would rather report on a large trend backed up by multiple preprints that are starting to show the same thing, rather than focusing on one thing that may turn out to be too small or ever so slightly wrong, or a little bit more than that. My policy as of late has certainly been, I would much, much, much rather be right than first.
And Helen, how are you navigating all this?
Sorry about that. And sorry about that. I hope similarly, but I should point out something. I mean, Katie and I are both kind of in a bit of a privileged position. She isn't covering daily news. And while I do some daily news coverage, I also have the space to do contextual pieces and stand back pieces. I'm not expected to have to produce something on everything that moves, and so that gives us some leeway to make some decisions about does this merit it, should I wait to see if this is part of a larger trend. There certainly are people who don't have that luxury in our business. And for them, I would say, to be really careful about preprints. They are hugely valuable. I think back to the beginning of the pandemic. There was a, hugely important preprint out of Germany. Christian Drosten's group did the first work to determine how long people who were infected with COVID were infectious, emitting virus that could infect other people. The world needed to know that, and the world needed to know it faster than he could have gotten it into New England. So it was really useful that it was on a preprint server. Likewise, South Africa has been doing the world a huge service, releasing data very, very quickly about what they were seeing with the Omicron wave. But there are other preprints that just really, they're never going to make it into print, and they won't get past the peer review process because they're just not good enough. But the unfortunate thing is that some of them look sexy or look, like they're going to make a great headline, and they do occasionally draw a lot more attention than they ought to. I just think at this point in my career, my general position is, there has to be a really good reason to write about this individual study, and if there is, I think it's, if I think it tells readers things that they need to know and I have time to do it, I will do it. But, think long and hard, think about who's doing the work, look into, how much the people who've done the work have done in this field. If this is the first paper they've written on COVID, maybe, and they have, some extraordinary claims, then maybe put that one on the back burner and see, how it holds up after a week or two.
And Helen, when we were talking the other day, you mentioned just the classic journalistic question about, who benefits from this, whatever, this preprint or this announcement, and not setting aside that skepticism because it's something is being called, a scientific advance. And I'm guessing that's an important part of your decision making as well.
Yeah, that the context for that was that I think you'd asked us about studies that are funded by industry, for instance, or funded by somebody who has a vested interest in you covering the release of their data. I just think it's really important to figure out whether in a circumstance like that, let me rephrase it. If somebody's going to get a huge advantage out of me writing about their study or their data or their product, there has to be a bigger advantage to readers, in my mind, to make it worth writing about.
Thank you. And switching gears a little, for both of you, equity and has been a very central theme of the coverage of this pandemic. And given the moment we find ourselves in, what equity issues should reporters be thinking about, both in their own communities and globally?
Yeah, I think this is one of the most undercovered aspects of the pandemic. I think especially here in the United States, where it is very easy to, I think, get sucked into the individualistic mindset that a lot of our communications inadvertently promote. With the idea that each of our health is in our own hands. This sort of movement toward do masks protect me? Do masks protect you? What is a vaccine for? Is it to prevent transmission? Is it about keeping you as an individual safe? And does that enable you to sort of resume normal life and almost check out of the pandemic? I think these are all sort of big questions as we move forward. I think it's already been abundantly clear that leaving individual decisions up to individual states, individual communities, single individual people has created a little bit of chaos. We are not really focusing on equity, which, again, is not just equality, handing everyone the same exact portion of something, but meeting people where they're at. If people are starting already from a disadvantaged place, can we do more to support them so that they reach the same level of protection, or that level of vulnerability is compensated for to a particular extent? These questions, I think, require putting more effort into certain pockets of the country than others, but it's really essential. I know this has become a trope by this point in the pandemic, but really none of us are safe until all of us are safe. That is, I think, the burden of a collective threat. And unless we address it collectively, it is not going to go away. I think one place where I still see this is still treating issues such as being vaccinated or unvaccinated like they are monolithic things. Really, I think that is one place where we can start talking about different levels of vulnerability moving forward, and using that as a model to make sure that different people's needs are addressed in the ways that they need.
And Helen, did you want to share your views on this equity question and what people should be thinking about?
It's a very broad question, and there are many angles at which you could come at it from. I guess one of the equity questions issues that has struck me throughout the pandemic, well, not throughout the pandemic, since about this time last year, has been vaccine equity. There's a huge imbalance in how vaccine has been made available around the world. And to me, it's quite interesting that there's very little discussion about it. The World Health Organization talks about it a lot, and so do some of the other organizations that are trying to get vaccine to low and middle income countries. But as a part of the sort of American conversation, or the conversation in other countries that are vaccine have countries, I don't feel like there's a ton of discussion about whether or not it's really fair to be vaccinating somebody a third time or a fourth time when other people have had no doses. That's an area where the world really hasn't done a very good job this time. I'm not certain it will do that it would do differently the next time. I think it might actually be worse the next time, because I suspect that more countries will lockdown vaccine supplies and hoard vaccine because they'll know that this is coming. But I do wish it was something that we spoke about more frequently and had an honest discussion amongst ourselves about.
Thank you. And I want to turn now to this idea about whether COVID is now endemic, and what does that really mean, and where is the line or threshold of epidemic versus endemic, and where do you go for good information on it?
Yeah, this is. I think I will start by saying we are not at endemicity right now. This is not what endemicity looks like. I think just looking at the rate of transmission right now, the enormous burden that is on our healthcare system right now. My preferred way of thinking about what endemic means, and I recognize that different people will have slightly different nuanced takes on this, so I will look forward to hearing what Helen has to say. But for me, it is more about equilibrium between a host population and a pathogen that is moving through it. I think there's kind of a misnomer going around right now that endemic, because it has, by coincidence, totally, the word end in it, that is like pandemic over, virus eradicated, gone. That is unfortunately not what it is. Endemic is endemos, kind of meshed into a population, something that is circulating somewhat frequently among us, but does not cause this burden of disease. It is coexistence. It's not necessarily super exciting or desirable, but it is much better than this. You can sort of look to the common cold, different versions of the common cold, the flu, for a portrait of what this could look like. Outbreaks when I think vulnerable populations tend to cluster together. This idea that, immunity can sort of wax and wane. Susceptible people are being born while immune people are dying. The pathogen may be changing as well, but ultimately it is not that difficult to sort of reset to homeostasis, where things sort of balance out. Things get a little off kilter for a while, but most of the time the scales sort of balance, and we are not being run roughshod over by the pathogen as we are at this point.
Mm-hmm. Yeah, I agree. I mean, I think people potentially confuse the fact that there's a general acknowledgement now that this virus isn't going away, that this is going to be part of the panoply of viruses that cause influenza-like illnesses at times in the year. I haven't heard anybody argue lately that that is not the case. This is with us to stay, but that doesn't mean we're at the place where it's going to be one of those viruses. I mean, we don't close restaurants, in bad flu seasons. We don't, I mean, it's conceivable schools might close if there were not enough teachers, but we don't take the kinds of measures for those other kinds of pathogens that we currently are finding ourselves having to take for SARS-2, because otherwise, society would have trouble functioning. Hospitals wouldn't be able to keep up with the crush of patients. So yeah, we're not there yet. I think there's a lot of discussion and maybe optimism that we may be approaching that. And a piece that I wrote today, several of the people I spoke to for it thought that we could have a lull after Omicron, because there's just going to be so much immunity in the population that transmission may subside for a while. But if that happens, does that mean we're sort of transitioning into endemicity? Don't know. Could there be other big waves after this? It seems hard to believe that anything could top Omicron, but no one predicted Omicron. So I think we would be unwise to think that we know all of the virus's tricks at this point.
I'm going to ask both of you a last question before we turn to our audience here. I see there's already some questions in the Q&A panel on Zoom. I will just urge you all to, if you have a question for our speakers, put it in the Q&A panel, not the chat. It's a little easier for us to call to read those out. But before we do that, I just wanted to ask both of you about this idea of, we're now entering our third year of this really fast-paced story, and that it's, pretty exhausting. And how has that relentless pace affected both of you emotionally, and what are your strategies for avoiding burnout?
It's tough. It's been a really full-on couple of years. I started writing about this in early January of 2020. And there have been points where I've been exhausted. Early in the pandemic, there was a point where I was overwhelmed. It just seemed so huge. It was hard to figure out what to do next. I am fortunate in that I have a fabulous editor who helps me figure out things and both how to carry the burden I'm trying to carry and what not to put into the pack on my back, what to drop and when to call for additional help. So, and then of course I have a lot of wonderful colleagues who are very good on this story, so it's not all my burden. But it has been very full on, and I look forward to a time when it's not this full on. I want to write about something else.
Yeah, I very much agree with that. Certainly throughout last year and the year before, I tried to make a concerted effort to write about other things just to sort of preserve my sanity. But even that wasn't that frequent. And, this calendar year, I have yet to write on not COVID. It has been really difficult. And I am very happy to admit that it has been really, really, really hard on me. These past 2 years have been brutal. I have felt a lot of sadness, a lot of anxiety. I miss my friends. I miss my family. This sucks. And I think the more we can share that openly, the better. I don't think there is anyone who has just been 100% okay through all of this, or certainly if they're out there, I don't know. I don't need to seek them out. And I've just relied a lot on my colleagues and my editors as well. I'm incredibly lucky to be at an outlet that is just really supportive, not just after me for, what content I can produce, but making sure that I am okay as a human being. I make a very concerted effort to log off at a certain point in the evening and, preserve my weekends as best I can. It's not always possible, but I think that is essential. It helps me stay on when I do have to be on. And I don't want to give anyone the impression that, to do okay or well at reporting on this pandemic, you have to be on all the time or on call. I very gladly say no to things all the time because it is good for me and probably good for the people who would otherwise have to listen to me be grumpy and incoherent.
Let's turn now, and thank you both for these thoughtful insights, to our audience. We have a question from Bradley Craig, who says, why the intense focus on cases rather than hospitalizations and deaths? It seems like cases are unavoidable, so an unrelenting focus on case counts breeds fear. Why not report more about specific things people, groups, and organizations can do to manage illness and survive?
I don't disagree that at a certain point case counts aren't that useful. I don't write about them really. I haven't much for quite a long time. Metrics inform your story. They flesh out the narrative, but they should only be a part of the narrative. You use them as a tool to explain to people where we are. But I mean, those are not the types of stories that I write typically, and I don't actually think they're the type of stories that Katie writes either.
No, not particularly. But I guess this is still something I do think about quite a bit. And I certainly started thinking about this intensely when the first data on vaccine effectiveness was starting to come out, and people were sort of arguing over, should our fixation be on whether post-vaccination infections are leading to severe disease and death, or should we be counting every single positive test? These things matter. It really informs how we set our goals. But I absolutely agree with Helen. I try not to focus too specifically on the numbers. That's never going to be, the headline I'm after or the main put of a story I'm after. But I'm glad those numbers exist. What I try to focus on above anything else is trends. If I say a huge spike in cases, that matters immensely, right? I think, rather than saying we should panic about every single case, that still really informs, what transmission conditions are like, how quickly things are accelerating. And, cases are what lead to hospitalizations and deaths. I would also argue against focusing exclusively on hospitalizations and deaths because, while those are really important metrics to focus on often, especially knowing that the burden on our healthcare system is immense right now, there are many, many cases of COVID-19 outside of the hospital that warrant immense attention and have been, I think, glossed over throughout a lot of the coverage. It's really a tough balance, and I don't think there is one right answer here. It sort of depends what story you're telling, what you're trying to communicate to your readers, and no matter what, I would never, under any circumstance, just want a single number to represent everything in a story for me.
Can I add something? I would say too that the importance of numbers and particular metrics, I think, varies at different parts of the outbreak. I mean, at the beginning, when something's taking off, you really need to have a good sense of that.
Mm-hmm.
Right now, I think we're in a transition period where case numbers are becoming less and less reliable. I mean, that's been true for a while. It's always been true, given that, there have been people who've been infected and didn't know it, and people who've been so mildly infected they never came to attention. But, with the current wave being so massive and so impossible for the testing system to keep up with, I mean, we just don't really have a good sense of what is going on there right now. And at some point in time, we're not going to count things in this way. We don't count flu cases case by case. They estimate flu based on, models that and algorithms that I can't describe to you very quickly, but effectively, our understanding of how bad a flu season is based on a bunch of estimates that are made. No one tries to count flu cases. And at a point, that's what we'll do with COVID. But and I think the transition point between trying to count and estimating is going to be an uncomfortable space for a lot of people to be in. And, we may be at that point now, I don't know, but, or soon, but yeah.
Helen, just to follow up on this point, many reporters are covering COVID as a local story. And so they're really watching these kinds of numbers closely. And how does things like the testing infrastructure and the lab infrastructure play into even what is being captured?
Well, if you can't test, you don't have a great sense of, how much is going on. There are other ways to sort of figure it out. How many schools are closed because there are too many sick students or too many sick teachers? How overwhelmed is your hospital? Are the pharmacies in your community open, or did they have to close because there were too few healthy workers today? But that's a time-consuming and imprecise way. I mean, those are useful things to point out to people in a story, and in fact, they could convey how bad things are in a way that actually makes more sense to people. Like 5 of the 8 pharmacies in our town weren't open today. If that's true, that's a that's an important story, but it's also nice to have, a sense of what's actually happening and how much of a handle authorities have on how big the case count is.
Are you going to add something on that, Katie, before I go to the next?
Oh, I guess I'll just add quickly, certainly capacity for testing right now is kind of a disaster everywhere right now. As Helen pointed out, everywhere we've been underestimating cases this entire pandemic, but I think counts have been especially unreliable. And so to take this all the way back to the beginning of our conversation, this really muddles how we can say, are we at the peak right before it, right on top of it, right after, and how is that going to differ locally? That's going to be, impaired or enhanced by local testing capacity. I think it's also important to point out that right now that, rapid tests have really helped a lot of things, but they are often not reported. That really, really obscures a lot of the data that researchers are using to sort of track the spread. And again, totally agree that, we won't be counting cases like this forever. But right now, if there has to be a focus on understanding transmission and how quickly this particular variant is spreading, that has made it really difficult for models to gather accurate data. And so these are all things to consider when counting up those cases and reporting, what the trends are. Often it's a reflection more of capacity than what is actually happening on the ground.
Thank you. I'm going to share some questions from Maxi Jackson. I'm going to kind of merge two of her questions because they're related. She says dissident scientists, public health officials, and so on are being dismissed as purveyors of misinformation, some being silenced. As journalists, how do you maintain a firewall of independence from the CDC around sources used for stories? And then she asks also, what tools are you using to fact check and verify government narratives around COVID-19?
I'm not sure I understand the first question terribly well. I don't, the CDC has no role in choosing who I speak to. I mean, they can prevent me from speaking to a CDC employee. I have to get clearance to do that, for an on-the-record interview. But in terms of, who I speak to for my stories, that's my call. And, occasionally my editor may suggest somebody or ask about somebody's views, but there's really, I have no concerns about, any organization sort of impeding on my ability to interview people as broadly as I need to.
Yeah, I think I'm in the same boat, and I apologize if I'm misinterpreting any of this. I think where I stand on this is really just that I try to report what I see fit, what is going to best serve my readers, and sometimes that is critical of what the CDC is doing. Sometimes it, references things that the CDC is doing quite neutrally. Sometimes it comes out reflecting somewhat positively on the CDC. And I don't think, too many other the parties that have sway over that are me, my editors, and certainly my sources. Yeah.
And how do you vet those government narratives, to return to the second part of her question?
I'm sort of drawing a blank here, and I wonder if either of you can think of an example that we can sort of maybe jump off of.
I guess I would vet government narratives in the same way as I vet anything. It's kind of like, does that make sense? Does that mesh up with what I'm seeing? Does it mesh up with what I'm hearing? I don't cover the Washington side of the story very much. I'm much more in the science side of it. So I'm maybe not the best person to ask about this, but well, for instance, in the previous administration, there were some claims that were made that were not science-based. Those tires got kicked pretty hard. Were the, current administration to say something similarly unsupported by science, they would be kicked pretty hard. I mean, look at how much blowback CDC has gotten over the change to its policy on isolation, how long people need to be in isolation after having COVID, and whether or not they should be tested on the way out. I don't think there's an evident risk that they're not being held to account. In the converse, in fact, I think they are very much being held to account. They're certainly under fire these days.
Thank you. And can I switch now to a question from somebody that really gets at what is journalists' role in all this? And this is from Ike Sweatlets, who says, I'm curious, what experiences have you had with your stories changing regular people's minds? For example, people who didn't want to get vaccinated, who read your stories and realized that they should, or people who weren't wearing masks in crowded public places and read a story about hospital chaos and realized they should. And then he goes on to say, what methods of storytelling or journalism that effectively changed people's mind, or what methods of storytelling and journalism that play into polarization and should be avoided?
So disclosure, Ike used to work for STAT. He is a former colleague of mine. I can't really, I'm afraid I can't answer that. I don't have, I don't have stories to tell about somebody approaching me and saying, I read your story and I got vaccinated. My stories are a little bit not at that level, I think. So I don't know. I'm going to lob this one at you, Katie. Do you have?
No, I mean, it's interesting. I can think of some instances where people have written me emails and said, you helped me convince my parent, friend, whomever, or even, me, myself to get vaccinated. But I also can't confirm I was not there. If it's true, I'm delighted. That's great. I'm glad people are getting protection for themselves. But, I think I'm certainly not tallying up those responses as a direct measure of, impact or success. I want to make sure that people are getting the right information. If it changes behavior on big scales, that's very cool. Hopefully it's in the right direction. But I guess, thinking about storytelling generally, if people are being swayed by those stories, I think things that I do try and think about is, if this did happen, why did it? Was because I explained something particularly well. How can I do that again? Can I make a note for next time to replicate that? Or if I confuse someone, how can I avoid doing that next time? If I share a personal anecdote from someone who has lived a unique experience within this pandemic, how can I do that again? How can I find those correct sources? And this is something that I also pay really intense attention to when I read other people's work. If I see that they have talked to someone who really opened up to them and was able to share something that, struck an emotional chord with me, even after 2 years of being, I think, pummeled by information on this pandemic. I think, what questions did this journalist ask? How did they get those details? Why was this story so compelling to me? How did it make me think about the pandemic differently? If I'm in a position where I'm able to share stories like that, I think that's pretty incredible. It's been a challenge to find those opportunities, especially not being able to meet people in person, see what their faces look like, move like, when, they're completely three-dimensional and not just on a screen or on the other end of a phone. But I've taken what opportunities I can, whether it's describing what scientists are doing in a lab or patients are experiencing in a hospital. It's really tough to report those stories, but I'm very glad that I sometimes have the chance to.
We have two similar questions that I'm going to combine, but before I do, we're hitting the end of our time together. Are you all able to stay maybe 5-10 minutes longer, or should we make this our final question?
I have a few minutes.
Yeah.
Okay, so Steve Novak and Karen Brown both asked a similar question about how to approach this as a local reporter. Steve says, any advice for local reporters who want to find good expert sources without necessarily going through a hospital PR department? And Karen Brown says, you both cover COVID as a national story. Any particular advice to local reporters, questions to ask local leaders or health officials that might vary from region to region, local COVID topics that we're missing?
So really good questions. I've never been a local reporter, actually. So everything I say, please take with at least 1.5 cups of salt here. But, I think one persistent challenge for me, and I imagine many other reporters, is finding fresh sources at this point in the pandemic and not just calling the same people over and over. Some of those sources are wonderful and I could listen to them talk all day, but fresh perspectives are essential. And I think a lot of the local story is getting missed at the national level. There's an enormous bias to interview people from some of the big academic center heavy cities in New York, Boston, Los Angeles, San Francisco, all of these places where there's going to be a unique take on the pandemic. And some of my most insightful sources have come from rural Missouri, rural Vermont, things like that. So it's always something that I'm trying to pay attention to in terms of, trying to contact those sources and not having to go through a PR department. Honestly, I found Twitter to be really productive. If people have DMs open, it's great to just reach out. Lots and lots of email sleuthing, whether it's digging someone's email up from like a corresponding author email on a paper to just finding a CV buried somewhere on someone's website. I have cold called people, though I am slightly afraid of doing that because it is scary, but sometimes it totally works. And I also have made it a point to ask sources that I know very well, hey, who else could I be talking to? I bother you a lot. Can I broaden my reach? Can I even talk to one of your students? They might offer a fresh perspective. And that has been really enjoyable for me. And I think that ties pretty closely to the second part of the question, which is, finding sort of unique local angles. If I do speak to someone that I haven't had the opportunity to talk to before, or is from a community that I have not been able to represent thoroughly in my coverage before, or is, an expert in an area that I don't have a lot of expertise in, I make it a really big point to ask toward the end of my interview, what have other reporters missed? What have stories on this topic missed? How can I, do a better job of just either asking the right questions or inserting the right information into this? What have people missed? What can I avoid missing to sort of change the narrative here or push it in the right direction? If it is a self-serving answer I try and take note of that, but I always get a really interesting, at least provocative answer.
That all sounds quite helpful. I also, I was a local reporter very early in my career, but haven't been for quite a while. So feel maybe not super versed in how to approach it, but I guess I would think about it, it depends on what type of story you're trying to tell. As I said earlier, the pandemic story is not just how many people are catching this virus and dying from this virus or being hospitalized. It's what it's doing more broadly. And certainly, I would be interested as a reader in a smaller community right now to know how COVID is playing, how Omicron, is playing out, in my community. Is garbage collection being affected because there aren't enough people to drive the trucks? Are school lunches being canceled because people can't, the cafeteria staff are sick? Is the hospitals able to, meet the food needs of the people who are there and working? I think that there would be a lot of, right now, the thing about Omicron is that a lot of people are sick at once, and that has implications across the board. We saw it at Christmas with airlines having to cancel thousands of flights because they didn't have healthy crew. That is playing out on, a different level through a lot of different sectors. And I think, you could do a good job telling your community what it looks like and, how they can navigate, how can they can sort of surf this wave without, being pulled under by it.
We'll have the final question from Sylvia Yee, who says that she wants to know how we can unearth disparities in the impact of COVID without a focus on case counts, along with hospitalization, death rates, and so forth, and says that she's particularly curious about disability because data on that is not generally collected. And it's easy, she says, to dismiss the impact on people with disabilities. Any insights there?
Can you repeat the question? I'm not clear on the first part about it.
The first part was, how can we unearth disparities in the impact of COVID without a focus on case counts? And then she goes on to say, along with hospitalizations, death rates, and so forth. So broad, and then asks more specifically about disability, because that's not being tracked per se.
Yeah, I mean, I certainly at the beginning of the pandemic, and not just the first few months, but the first year or whatever, it was really important to see who was being hardest hit, and the only way to do that is by collecting data. And so seeing that, communities of color, communities of, where people are economically disadvantaged were being disproportionately punished by this virus. I mean, yes, you need to collect data to surface that kind of information, and that has been really important. Likewise, I completely agree that there probably are communities of within the disability community that are being hit to different degrees. We certainly know that, we certainly know that, for instance, people who are immunocompromised are very vulnerable. And we know that people who've had solid organ transplants are very vulnerable. I don't know if one would define them as people with disabilities. We also very much know that people with Down syndrome, for instance, and learning disabilities have been very badly hit through the pandemic. And, I'm not sure those stories are always being told to the degree that they deserve to be told.
Yeah, I absolutely agree with that. And I think here this comes back to the power of narrative and really listening when readers try and catch your attention. This really reminds me of how stories of long COVID really first took shape. And here I have to give my colleague Ed Young enormous credit for really starting to listen to some of those long haulers who initially emailed him as far back as early summer of 2020, when long COVID was getting no appreciation even from the medical community. Patient concerns were being dismissed. I mean, they're still being dismissed, but he really took the time to listen to those concerns, not gaslight them. Ask, what is going on in your communities? And he really just unearthed this enormous group of people who had sort of taken it upon themselves to reach out to each other, find support with each other. It's certainly not the only grassroots group that has sprung up throughout the pandemic, but, just sort of always paying attention when people are sharing their experiences on Twitter, reaching out when it feels appropriate. And of course, vetting those sources to make sure that they're giving you accurate information and you're not telling a story that has been warped in some way, but also just being really open-minded. If something surprises you, follow up on it. I think I did see a story in the Times recently that I thought was really nicely done and captured one of these inequities well. People who are blind or vision impaired are having trouble using SARS-CoV-2 tests. And, that is a huge consideration, right? If the tools that we're using for this pandemic are not equitable or not accessible, that really impacts who most benefits from them. That is, a theme throughout this conversation. We need to be focused on equity. And these are things that people who are not visually impaired, who are as I am, privileged enough to be able to access all of these tools and be able to, isolate at home if I need to. These are not things I think about. So I'm really grateful when readers bring them to my attention.
Well, I want to thank both of you. This has been a wonderful conversation, and I want to thank our audience for their thoughtful questions. We will be archiving this webinar on centerforhealthjournalism.org a little later today. And please have a wonderful afternoon and take good care.